For this online lecture in EXE 234, Introduction to Exercise Science, we will be discussing the specific parts and purposes of equipment used in the field of exercise science. Why is it important that we understand the different pieces of equipment used in exercise science? First, proper pronunciation is important to help establish our credibility in the field. Second, we want our clients or patients to feel as comfortable as possible while we are working with them. Explaining each test and piece of equipment used while you are working with your client or patient will help put them at ease. And third, prior to doing assessments on clients or patients, we have the individual complete an informed consent. An informed consent lets the individual know ahead of time what we are assessing and that the assessments will remain private. The information gathered will not be shared unknowingly with outside parties. If the client or patient has questions during the informed consent process, knowing the equipment and purposes will help you to answer those questions. Some of the equipment we will discuss in this lecture are included in your EXE 234 equipment package. It would be beneficial to go through the equipment as we discuss them. The first we will discuss is the stethoscope. The purpose of the stethoscope is to listen to internal sounds within the body. The most common sounds we will listen to are the heartbeat or the heart sounds and different sounds of the blood going through the arteries. This is also known as blood pressure. The stethoscope has two ear tips. When we put the stethoscope into your ears, we want the ear tips to be facing forward towards your eyeballs. You can move these ear tips forward or away. We want them to be facing towards the front of your head, not towards the back of your head when you place them in your ears. The next part is the binaurals. This is where the sound travels through up to your ears. We have the brace and the tubing. If the tubing is kinked, it will impair your ability to hear. The last piece is the chest piece. The chest piece rotates around. As you rotate it, tap on one side. If you do not hear anything, rotate it again 180 degrees and tap on the same side. You should be able to hear. The smaller part is the bell. The larger part is the diaphragm. When we are listening to low frequencies in the body, we will listen with the diaphragm. If we're listening for higher frequencies inside the body, we'll use the bell. Most often in this class, we'll be listening for lower frequencies, so we will use the diaphragm side. The next piece of equipment is a sphygmomanometer. It would be beneficial to practice saying this term, sphygmomanometer. It is more commonly known as the blood pressure cuff. There are a couple of different components to the blood pressure cuff. One is the bladder. The bladder is the area inside the blood pressure cuff that inflates with air. The next part is the aneroid gauge. This is what tells us the specific pressure of the air inside the bladder against the arm. The next is the hand bulb. The hand bulb inflates the bladder with air as it is squeezed. And the release valve releases the pressure from the bladder. The release valve is controlled by using your thumb and your pointer finger to slowly or quickly release. Another piece of equipment in your EXE 234 equipment package is the heart rate monitor. The heart rate monitor uses electrical signals within the heart to see or understand what the heart rate is. The heart rate monitor will include a strap and a watch. If you flip your strap over, you will see a little bit of a bumpy area. These are the electrodes. The electrodes are what pick up the electrical signal. If you place the heart rate monitor on and it is not connecting, the electrodes may need to be wetted with either an alcohol swab or with water or saliva. The strap needs to be fitted tightly with the connector right over the sternum, or it should be right in the center of the chest. The watch is what receives the information and provides the actual heart rate. The watches we will use in class are coded so that if you are using a heart rate monitor and a person beside you is using a heart rate monitor as well, you will not pick up their heart rate. Your watch should be coded to your specific heart rate connector. A tension tape measure is used most commonly in exercise science to determine circumferences, or the distance around a specific body part, such as the waist or hips. The tension tape measure has a retract button so that when you put the tape measure around a person's waist or hips or another body part, you'll click the retract button and this will help pull the tape measure tighter. The tape is the part of the tape measure that has the numbers or the measurement. Most commonly in exercise science, we are going to use the metric system. So we're using centimeters and millimeters instead of inches. Our tape measures in class do not include a tension weight, but a tension weight can be added. The tension weight helps to ensure accuracy. As you wrap the tape around a person's waist or hip or other body part, you click the retract button. The tension weight will help to pull that tape a little bit tighter for the most accurate measurement. A goniometer is used to measure flexibility of specific joints. The goniometer has a moving arm, which will have the numbers on the side. The body is a central circle, and the stationary arm is the arm that does not have any information on it. We will place the body next to a joint, such as the shoulder, and then you can move the arm upwards or backwards and measure the degree angles of that specific joint. Knowing the flexibility or the degree angles of a specific joint can help us determine if that person is too flexible or not flexible enough, and can give us information on what we need to work on. Goniometers are available in all different sizes. The one we'll be using in class is a smaller goniometer, often used for smaller joints. Larger goniometers are used for larger joints, such as the hip joint. A sit and reach box is also used to measure flexibility, specifically in the hamstrings and lower back. The finger plate is what an individual will push with both of their hands on top of each other, reaching as far forward as they can, while their feet are planted on the feet plate or the foot plate on the box. The scale is used to measure how far a person can reach forward. This is a skin fold caliper. We will be using a skin fold caliper from your EXE 234 equipment package. The one we will be using in class is black. There are different types of skin fold calipers. A skin fold caliper is used to measure the fat underneath the skin. You will grab a portion of the skin, pull up, and then measure the fat underneath that area. We will practice this when we are reviewing body composition later in the semester. The different parts of the skin fold caliper are the jaws, which are what clasp onto the fat, and then the caliper handle, which is what we use or you press down to open up the jaws. The fat is measured in millimeters and can be seen on the scale. Pedometers are used to measure how many steps a person takes. Pedometers can be very basic to very complex. The pedometers we use in class calibrate the distance of your steps to determine how many steps you take, while others do not include how wide your step is, but simply rely on a little ball inside the pedometer that moves back and forth as you start to move. An accelerometer and a pedometer are similar but have a few different qualities. A pedometer only measures steps, while an accelerometer measures steps along with the intensity of those steps. So if a person is moving slow for some steps and quick for others. There are lots of different types of accelerometers, and the different types of products have increased in the last couple of years. A new product is the Fitbit, which is a bracelet that an individual can wear and sends information to their iPhone. Accelerometers can be specifically used on the belt line, or we can put accelerometers in shoes as well to see if a person is moving quickly during different steps or slowly in other steps. A stadiometer is used to measure height. At the bottom of a stadiometer is a base. We have a person stand on the base without shoes, with their heels against the back. The rod is a stationary part, and the head plate is attached to a movable part. We will lift the head plate up, extend the head plate, and then lower down onto a person's head to measure how tall they are. To find exactly how tall a person is, we will look at the number between the movable arm and the rod. A beam scale is used to measure how much a person weighs. An individual will stand on the platform. The pillar attaches to the weighing ruler. The main poise weight will be moved over. There are 50, 100, 150, 200 different weights on the main poise weight. The accessory poise weight will be moved along to determine the exact weight. The accessory poise weight is attached to the weighing ruler. The zero adjusting scale allows for calibration. Prior to an individual standing on the scale, we need to make sure that the scale is calibrated correctly. All the weights, the main poise weight and accessory poise weights, will be placed on 0. The beam should be balanced. If it is not, we use the zero adjusting screw to calibrate the beam scale back to 0. A bioelectrical impedance analyzer is used to measure body composition. So it helps us to determine how much of a person's body is fat mass and how much of a person's body is non-fat mass, to include muscle or bones or other tissues. There are different types of bioelectrical impedance analyzers. This is the most common. It has electrodes on the side. Bioelectrical impedance analyzers send a small electrical impulse through the body. Very few people actually feel this impulse. As the impulse travels through the body, it will travel quicker through muscle and slower through fat. How quick it is able to travel through the body provides us with a percentage of body fat. A person will hold on to the electrodes on the bioelectrical impedance analyzer. For individuals who have a electrical piece of equipment implanted in their chest, we do not use bioelectrical impedance analyzers. That is a question that must be asked prior to doing this assessment. A metronome helps keep beats. There are certain assessments in exercise science where we need the individual to perform at a specific cadence. A metronome allows us to use audio or visual cues to help the individual perform at a cadence. Metronome apps can be found on different smartphones, or a metronome is also a separate piece of equipment that can be used. A vertec is a piece of equipment used to measure vertical jump. Vertical jump is a good measurement of lower body power. The base of the vertec will need a couple sets of weights to keep the vertec from falling over. Generally, 45-pound plates will be sufficient to keep the vertec on the ground. The vanes are half-inch slats. We ask the individual to jump up and hit as many veins as possible. The reset pole allows us to move the veins back in order. A hand dynamometer measures hand grip strength. Hand grip strength is a direct correlation to upper body strength. So by measuring a person's hand grip strength, we can get a lot of information about how strong their upper body is. Because everyone has a different size hand, we will calibrate the hand dynamometer based on hand size. For individuals with smaller hands, we will move the middle grip and the main grip closer together. For individuals with larger hands, we will move them farther apart. We will measure this using the grip range scale on the side. The knob is used to calibrate based on hand size. After the person pulls the middle grip closer to the main grip, an indicator will tell us how many pounds or kilopounds they are pulling. The pulley in the center of the hand grip dynamometer is used to reset the indicator. A blood glucose meter is used to measure sugar in the blood. A test strip is placed in the meter. We will use a lancet to draw blood. A lancet is a small needle. We will prick the skin on the finger to draw out a drop of blood. The lancing device is what we place the lancet in. A lancing device will have a button that provides a quick release of the lancet. Once the lancet has pierced the skin and a drop of blood is formed, we place that drop of blood on the test strip, and the meter will tell us how much blood glucose is in the blood droplet. A bod pod is the gold standard for measuring body composition or figuring out how much body fat or non-body fat is in the body. A person will sit inside the bod pod wearing a swimsuit or very tight clothing, placing the hair in a swim cap. The bod pod closes through large magnets. A person will sit in the bod pod for approximately 30 seconds. Air is placed in the bod pod. The bod pod analyzes how much air is in the bod pod and how much pressure. By using that information, it can calculate how much body fat a person has and how much muscle a person has. A DEXA scanner is another way to calculate body composition. A DEXA scanner provides a little bit more information, though, than just body fat and muscle mass. The DEXA can also look at how dense a person's bones are. An EKG or an ECG is an electrocardiogram. An ECG provides us with information on the heart's electrical conductivity. The electrodes are 10 wires attached to an electrode. We attach those to the person's chest. The live ECG screen provides us with information on the heart's electrical conductivity. We can see if the heart is functioning normal through an electrical perspective. We can also see if a person has had a heart attack in the past, if they are currently having a heart attack, or if there is any abnormal electrical conductivity. An ECG can then be printed. In exercise science, we can do ECGs at rest, or we can do ECGs during exercise. A lot of times, ECGs during exercise provide us with significantly more information than ECGs at rest. A metabolic cart measures how much oxygen a person's body takes in and how much carbon dioxide, or CO2, a person's body expels. We can place the mask on the individual, and the mask has several sets of one-way valves, allowing oxygen to move in, measures what the person intakes, what the person is expelling, and then allows the CO2 to escape out the other side of the mask through the one-way valve. An oxygen calibration tank is used to calibrate the metabolic cart prior to use. The air volume calibration is used to measure air volume. It's very similar to a set of lungs. So it calibrates based on the approximate air volume in a person's lungs. And the live gas analysis will tell us what information is provided through the mask and through the person's breathing patterns. The metabolic cart can tell us how often a person is breathing, exactly how much oxygen they're taking in, how much CO2 they are producing, and the ratio between the two, the oxygen and the CO2. A postural analysis chart helps us to understand the skeletal composition of the body to determine if it is straight or if it is abnormal. We can have a person sit, stand, do squats, do other activities, and also take pictures to analyze their posture. This can provide us information to help create exercise prescriptions to help the person improve on their posture. An ergometer is a bike where we can adjust how quickly a person rotates the pedals. We will call that RPM, revolutions per minute, and also allows us to determine the specific intensity or resistance. By using these two things, the revolutions per minute and the resistance, we can do certain tests to determine the fitness level of the individual. The best way to get comfortable with using the equipment is to practice. Since you have a set of equipment at home, I recommend you practice saying the terms, practice on your roommates, practice on yourself. Use the equipment. The more you use the equipment, the more comfortable you'll be. And when you meet with clients or patients in the future, you'll be very comfortable assessing the individuals.